So PUCCINI is a retrospective study conducted at the Institut Jules Bordet that aims to evaluate the metabolic response assessed by PET CT scan in patients with hormone receptor positive, HER2 negative metastatic breast cancer treated with the CDK4/6 inhibitors and endocrine therapy. And of course, the aim of the study was to evaluate whether this early metabolic response is associated somehow to survival outcomes of these patients. So just to provide a bit of context of this study, we know that breast cancer is the most common malignancy among women worldwide, and we know that hormone receptor positive, HER2 negative breast cancer is the most represented breast cancer subtype, and it accounts around 70% of all breast cancer diagnoses. So we are talking about a major public health problem. And for these patients, for patients with hormone receptor positive, HER2 negative metastatic breast cancer, CDK4/6 inhibitors plus endocrine therapy represents the standard of care in first line, and also a valid treatment options in later lines for those who didn't receive CDK4/6 inhibitors in first line. The problem is that so far we do not have any validated biomarker to identify those patients who will respond to this treatment. So in other words, we are not able to select in advance those patients who will have a survival benefit from a treatment with the CDK4/6 inhibitors plus endocrine therapy. So the aim of PUCCINI was really to evaluate whether the evaluation of metabolic response assessed by PET CT scan could be able somehow to identify those patients who will respond to CDK4/6 inhibitors. And the rationale that lies behind this hypothesis is that metabolic changes in the tumor occur earlier than morphological changes. So PET could identify somehow some changes in the tumor earlier than what the CT scan can do. So in our study, in the PUCCINI study, we included patients with hormone receptor positive, HER2 negative metastatic breast cancer treated with CDK4/6 inhibitors plus endocrine therapy at the Institut Jules Bordet. All these patients had a PET CT scan performed at baseline, namely before starting the treatment with CDK4/6 inhibitors, and at the first disease re-evaluation, namely around 3 months after the start of the treatment, with a window of flexibility of 15 days. This is a preliminary analysis, so the analysis was conducted on the first 28 patients enrolled in PUCCINI, and the metabolic response was assessed using 2 classes of criteria, the PERSIST criteria and the CONSIST criteria. And what we observed is that in these patients, metabolic response, both assessed by CONSIST and PERSIST, was significantly associated with the progression-free survival in these patients. The data on overall survival were not presented because the data are still too immature to drive any conclusion in terms of association with overall survival. But still, our data are interesting because it seems really that PET CT scan could be a promising tool to identify those patients who will derive a benefit from a treatment with CDK4/6 inhibitors plus endocrine therapy. Of course, our study has some limitations because it's a retrospective study with a relatively small cohort in this preliminary analysis, and also with a relatively short follow-up, especially for the overall survival data. But still, I think it's interesting to see how PET seems to really anticipate the diagnosis of disease progression, with all the implications that this can have, also in terms of, for instance, of cost saving, that is a very important topic in modern oncology. And of course, more mature data on a larger cohort from the PUCCINI study will help us to provide stronger data on this topic.